Hello, everyone. It's Terry Cook with Aortic Hope, and I'm going live tonight, and I'm actually excited to get to do this. And of course, we have Dr. Kristin Watson. She has been on many times to talk about the medications and things that we can do as far as aortic disease. Um, Sorry, we're a little bit late. We had I had some technical difficulties. So anyway, so I'm going to turn it right over to Dr. Watson, and we have a PowerPoint that you'll be able to follow along with, and please feel free to jump in and ask any questions.
Awesome. Well, thank you all for having me back. It is so funny because I was on vacation this summer and one of my children decided that he needed to see me on YouTube because another kid said I'm on YouTube. And he found one of our prior recordings and then insisted he had to play it for everybody. So I hid outside. And I go, oh, I have to find out if I can come back at some point. And I kid you not, later that day, I got a message from Karen and said, hey, can you come back and do another session for us? So as always, I am super delighted to be here. And Terry, I thank you for taking responsibility for the tech issues. But despite me trying to get on very, very early, as early as requested, I could not get on. So that,
It's fine.
listen, y'all know how it goes with tech. So for those of you who have joined before, I'm excited to have you back. And I have some new content that I added to this presentation based on feedback, insight I've received from audience members. And if you're new, as Terry mentioned, please ask questions. Josh will jump in and read those questions out to me as our amazing IT guru for this. And we will as we go. And then if you have any lingering medicine questions not related to the content that I'm going over, I will do my very best to answer those questions in the time frame that we have. And so I recognize many of you may have aortic disease, but you also might be on cardiac medications for other indications as well. So if you can flip to the next slide. And some of these medications have multiple reasons for why we use these. So the first medication class I wanted to talk about are our antiplatelets. So these are medications that can be prescribed for individuals if they have had aortic surgery, maybe they've had other forms of cardiac surgery. And so as platelets, I think about our internal Band-Aid. So if we cut ourselves or if there's damage to, say, an area for surgery within the body or plaque ruptures within the body, the platelets are what are jumping to that area to try to seal off where the trouble is. Well, that can be really helpful if we cut our finger, but if there's something internally and too many platelets get to the site of trouble, such as if you've had a stent for a cardiac stent, that can be problematic. So we use antiplatelets to kind of keep the platelets at a good level. For individuals with aortic disease and other forms of atherosclerotic cardiovascular disease. So I'm sure you have all heard of aspirin, that is an over-the-counter medication. And then there are 3 prescription medications in this group. The most common we see being clopidogrel or Plavix. So these agents, the last 3 are prescribed, but aspirin is available over the counter. I do ask that you never take aspirin without it being recommended by your vascular provider or a cardiologist, because you're on different medications and the role for things such as aspirin has really changed over the years. So we want to always make sure we have a good reason for that. And the reason I want to talk about are the side effects of therapy. So Terry, if you could click the next slide for me. So anytime we have drugs that are antiplatelets or working on platelets or other parts of the blood system, the biggest side effects that we can have is bleeding. So bleeding may not be, it could be a little bit of bleeding. You may notice that if you cut yourself, it takes longer time to heal. But if you ever notice you're vomiting blood, you have blood in your stool or urine that is new, we always want to reach out to our provider. Now, if you ever have concern for bleeding, what I need you to do is do not stop taking these medications. I need you to seek evaluation and talk to your cardiac or vascular provider or someone else that, if it's very serious, seeking emergent medical attention. But we don't want you stopping these on your own. The other thing that's really important as well is we're going to talk about another class of medication that can increase your risk of bleeding is the use of over-the-counter pain relievers. So we're getting ready to head into cough and cold season. A lot of those combination products that are out there have things like ibuprofen, Motrin, Aleve, and we don't want you guys taking those. That can increase your risk of bleeding, but also can spell trouble for some individuals with their heart. So if we're in this cough and cold season, I hear COVID is doing a real number, especially with throat symptoms this year. Things like Tylenol or acetaminophen is safe to use, but those other over-the-counter pain relievers, we want to keep them to the wayside. And then another thing we haven't talked about before, and I thought this is a good time to bring it up. There's a lot of interest in supplements and herbal. It's a multi-billion-dollar industry. And so that stuff is not very well scientifically evaluated and can pose a lot of drug interactions. And some of the biggest drug interactions that I see come with supplements or herbals are with medications and these agents can further increase your risk of bleeding. So please always, just like you would never take a prescription medication without your prescriber, I always want you to talk to your vascular or cardiac prescriber, a pharmacist, whomever you feel comfortable talking with to determine if there's drug interactions. Can you flip the slide again for me, Terry?
Hold on. Before we go to the next slide, the presentation is cutting off a bit of the slide. So we might have to go outside of the slideshow.
Okay. I wonder if it's the size of my slides. Thank you, Josh.
Yep. I want to make sure that we get all the words on the screen.
Definitely. Is there anything I can do on my end?
Just stop the slideshow.
Okay.
And then go back into the share. Because
Guys,
I didn't mean for you to stop the share.
How Terry got heart readers because I need to have them. I mean, I have a heart, like a actual, the shape of a real heart tattooed on my body, not like the traditional heart you see drawn, but I do need those heart glasses you have, Terry. They're super awesome.
Oh, my glasses. All right. Josh, I'm sorry. You know what? This is really bad.
Did you close the PowerPoint? Is it?
No,
there
I didn't.
It is.
Yeah.
All right. It's almost here, hopefully.
Terry, we're just entertaining people, okay?
Exactly.
It's what we're doing. So we thank everybody for their patience. So if you can go. There we go.
Yep.
What do you think? Just stay in the non-slideshow, Josh?
This looks great.
Okay. So if you can click the slide again.
Nope, that's the slideshow again.
All right. All right, what are we doing?
Josh, you want her to get out of slideshow?
Does that give me control?
You want me to stop sharing?
No. I want you to leave it right here and then go to the slides that she says with this. This will show the full slide. Yeah, just like that.
This is okay, got it.
And just like that,
sorry.
back to our regularly scheduled programming.
Thank goodness you're here, Josh.
Yes, and if you can pull down that, if you're able to lessen the note section, because I think there's some text cut off. If not, I will just read it out loud. So when we talk about, we're going to talk about our blood thinners. You may also hear them be called anticoagulants, and then one slide back, one slide down. Yeah. So we have several different anticoagulants on the market. So the one that we most commonly see, I think we want to go to the next slide, is many of you. The most commonly one prescribed in the United States is apixaban or Eliquis. So if anybody has an arrhythmia, such as atrial fibrillation, you may be on this drug. Certain people with that irregular heart rhythm require to be on a blood thinner. If you've had a blood clot in the past, you may be on one of these agents as well. There are several on the market. They're listed here for you. The decision on which one is used has to do with the presence of drug interactions, what your insurance company covers, and what your kidney function is. And that's of those first four. And then for those of you who may have had aortic disease for a longer period of time before these first few classes of medications came on the market, we were using what's called warfarin or Coumadin. There are still a select group of people who are on that medication, and you are followed very closely if you're on that agent. But there are very specific factors that are taking into place to pick the right blood thinner for an individual. And so a few things I wanted to point out for you is very similar to what I talked about with the antiplatelet therapy. I don't want you taking any over-the-counter medication, supplements, or herbals without speaking to your provider. It's also very important if you are on a blood thinner or an anticoagulant that any provider that you see, that can be your dentist, physical therapist, I want you to make sure that they know that you are on a blood thinner. One, you're at higher risk of bleeding. You're also at higher risk of bruising. So making sure, right, a physical therapist could be working on you and then they're like, whoa, what's going on? So it's not a contraindication to having dental work or going to physical therapy for any means, but you want that provider to be aware. It's also very important if you can carry a prescription card with you that you are on this medication as well. Bleeding is the most common side effect with this. The risk of bleeding is going to be higher than with those other medication class. But if this is a medication, if you need it, you need it because of there's significant groups of people who need it and is very beneficial. Now, if you would, heaven forbid, fall and hit your head, you may think, and you're on a blood thinner, oh, I'm okay. Well, unfortunately, if you had hit your head hard enough, blood can build in the brain, but it can take several hours for you to notice complications of that. So blood could be developing while it's very, very rare, could be developing, and someone might notice anything's wrong, or you might not notice anything's wrong until there's just too much there. So the good rule of thumb is if you fall and hit your head and you are on blood thinner, please go to an emergency room. No provider is ever going to turn you down for saying, I came to get checked out because I'm on a blood thinner and I hit my head. So we want you to seek that attention.
That is so important. So important.
So important.
I wouldn't have known that. I'm glad you're bringing all of this up.
Good. That's awesome. I'm glad it is helpful.
Yep.
And so the other thing is, if you have cuts when you're on a blood thinner, it's going to take time. You're going to have to hold pressure longer than you would have beforehand. I know that my husband was on one and, he gets procedures done, and first time he had an IV come out when he was on this blood thinner, I was like, oh yes, pharmacist over here forgot you're on a blood thinner and how long it took. They had to hold pressure to take his IV out. The Bigatran is one of the blood thinners on the market, also known as Pradaxa. If anybody's through Kaiser, I understand that might sometimes be their preferred agent. And Dabigatran, because of drug interaction, sometimes might be the anticoagulant to go with. This medication can cause indigestion, and up to 30% of people have indigestion. If you're on it and you get indigestion, please do not stop the medication. I want you, again, to call your provider and discuss this with them. They will then make an assessment. If it's the medication doing it, should we treat the indigestion or change you to another blood thinner? And then again, just like the antiplatelets, I really don't want you taking any of these medications without I do not want you stopping them without talking to your provider, because they all play such a vital role with what you have going on with your aortic valve or with your aorta.
Aren't there also medication? I mean, I would never stop anything, and you shouldn't stop anything without talking to your provider. But aren't there medications that you have to wean off of? I don't know if these anticoagulants are, but there are medications that you have to wean off of. You just can't stop taking it cold turkey.
Absolutely, Terry. It's funny because you have so many mannerisms of Karen. It's cracking me up. But yeah, there are some medications like we'll talk about later. There's a medication called clonidine. We don't ever cold turkey stop that unless somebody's in big trouble with it. But when we think about medications that need to be weaned, it's often things that will that are used for mental health, seizure disorder medications.
Right.
They tend to be a lot of the things that need to be weaned. But blood thinners, antiplatelets, if they have to be stopped or you're done with therapy, they just get stopped.
Okay.
But it needs to be done in the right, make sure treatment's complete, etc.
Makes sense.
The next thing I wanted to talk about, this nosebleed, just to go along with these two things, because this is, if you can click to the next slide, especially getting into cough and cold season. And so the reason I want to talk about nosebleeds is I practice inpatient and outpatient. And this is one of the most common things that people will have that I've seen if they are on a blood thinner or antiplatelet, especially once we now start, well, now I don't know, it's just very cold out for some reason here in Baltimore right now.
It is.
But yes. And so as we start putting our heat on in the dry air, I had somebody asking me actually about nose bleeding earlier today. So when you're on these medications, you can have a higher risk of nose bleeding. Just being in dry air, for instance, can put you at higher risk for a nosebleed. So the most important thing when you have a nosebleed is to prevent one from happening. So if you are on a blood thinner, an antiplatelet, and especially if the air is getting dry, rule of thumb is one, don't pick your nose, because the nose has a lot of blood vessels and will bleed very easily. And then you can use a cool mist, humidifier, or saline nasal spray or saline gel. Some people are just more prone to nosebleeds in general, right? So prevention is the key. But if you get a nosebleed, I see a lot of misconceptions among even patients and sometimes medical personnel. I feel like I'm an expert on nosebleeds because a lot of it has to do, we have a son who has nosebleeds and has gone through a lot of different stuff. So I tell my teams I'm the Joe Pro of nosebleeds at work. So if you get a nosebleed, you want to lean forward. And the reason you want to lean forward, because if you would lean back, the blood will go back down in your throat, get you very nauseous, and could make you vomit. So you want to lean forward. If you have, if you're prone to nose sprays, you can always spray Afrin, which you can buy over the counter, Walmart, CVS, etc., in the size that is bleeding. And then you're going to hold that soft part of your nose, so right below that body part, and you're going to hold that tight for, thank you, Terry, for demonstrating as well. You're going to hold that for 10 to 15 minutes. Now, you're going to want to peek, and you're going to know if the bleeding has stopped. But do not let go for 10 to 15 minutes because you want to really apply enough pressure to get it to stop. There's a lot of blood vessels in there. So what do you not want to do? Don't pack it. Don't place anything in there. And the reason is because if you put a tissue up there to catch the blood and you pull it out, you're just going to rip the scab off and you're going to rebleed. We talked about why we don't want to tilt our head back or lie down. Again, it will just go back down your throat and you'll be vomiting. And then you want to avoid blowing your nose for at least 12 hours because you want to give time for that to heal. You can always go on, there's some really great websites, like the different hospitals also have tips on nose bleeding. But if the nose bleeding becomes problematic or frequent, please tell your provider as well, because they may have some other information or want you to see an ear, nose, and throat. Fortunately, nosebleeds are not typically enough that we would ever have to stop a blood thinner. They can be very annoying, I understand. Okay, if you can go to the next slide. So now I'm going to switch focus and talk about different medications that you may take for high blood pressure. Some of our blood pressure lowering medications and other agents that I'm going to talk about can also be used for different indications outside of your aorta. And so some of the medications we're going to talk about are they help protect the kidneys from kidney damage over time. Certain things we'll talk about later might be used if you have atrial fibrillation or atrial flutter to keep the heart rate controlled. So one of the most common medication classes that we use here in the US and really worldwide are our ACE inhibitors or angiotensin converting enzyme inhibitors. I believe all of them are generic at this point. Most of them have been on the market since before I was a pharmacist, and I have been a pharmacist for a very long time now. So your drug, if you're on it, the generic name is going to end with pril. Lisinopril is the most common one we use in the US, but other ones include enalapril and benazepril. So their job are to lower blood pressure. We know that blood pressure control is one of the most important things that we can do for people with any aortic or aorta disease. And so these medications are typically, a lot of them are able to be given once a day. They come with some unique side effects. We continue that, thankfully, our hypertension or high blood pressure medications, we really consider pretty safe agents. With this medication class, it can develop a dry cough. I always say the cough is more annoying for the partner than it is for the patient. So it's going to be like this dry, hacking cough. The good thing is, if it would develop, I don't want you to develop it, but that if you were switched off to its cousin, which I'll talk about in a moment, that cough should resolve pretty quickly. So if it bothers your partner, and you think it could be it, please speak up to your provider. And it could happen at any time during therapy. So we think a lot of times, if we think about an allergic reaction to a medicine, that typically is happening very quickly. But some of the side effects that I'll talk about with these medications, just like with the blood thinners, can happen at any, you could be on it for a couple of days and it could happen, but it could also long-term being on these medications, it can develop as well. Dizziness, lightheadedness is a possibility pretty much with all the medications that I'm going to talk about from here on out. So I won't keep repeating that. And that's our job as providers to do our detective work. If you would develop dizziness or lightheadedness, is it a medication that is causing it? What's the most likely cause of this medication? But if you ever notice dizziness, lightheadedness, especially when you're getting up from sitting to standing or feel like you're going to fall, please contact your provider, because you may need to have adjustments in your medication made.
I was just going to ask you that, is that the dizziness and the lightheadedness could be that your blood pressure may be too low, for example, because I had that happen.
Yep.
And they had to adjust it. So yeah, it could be that, which is actually a good thing if it's kind of too low.
Yes.
We want it low.
Yes. And then, there could be people here who are on things like semaglutide, Ozempic, they're losing weight. Sometimes as people lose weight, they sometimes come off of blood pressure lowering meds, because 20-pound weight loss can really achieve a nice reduction in blood pressure control. So
I can attest to that.
That's amazing, Terry. That is amazing.
Yeah, it is.
Yeah.
Thank you.
Yes. And so with the other thing we need to think about is the rare serious side effect of this medication, again, it's rare, is angioedema. So like with any medicine or any lip, tongue, throat swelling, that is an emergency room treatment. You go right to the emergency room if you would notice lip, tongue, throat swelling, because we worry about your airway and being able to breathe. So it is quickly treated. It is a very recognizable side effect in the medical community. Again, it's happening to less than 0.1% of individuals, but it will happen throughout, can happen at any time during the course of therapy. And this medication class, you'll have to have blood work when starting it, and then periodically to monitor your potassium and kidney function. And I just want to point out before, you can switch to the next slide because it applies to the next drug class as well. A lot of people will, a great thing that we can do to help lower our blood pressure, in addition to weight loss and exercise, is limiting salt in our diet or sodium in our diet. So people will there's a lot of great different seasonings out there, but if the seasoning that you would pick that is a substitute for salt looks like table salt and it says it doesn't have salt, I don't want you using it, because they are very high in potassium. So things like Mrs. Dash is great because that just uses all different herbs. So if it looks like table salt, goodbye, because table salt we don't want to add. Slow and steady to wean it off, just like anything, small progress changes. And then some of our salt substitutes that look like salt are high in potassium. And too high potassium is not good for the heart. So this medication class, the angiotensin II receptor blockers, they end with, you can see ARTANS. These are an example. These are the most common ones that we see prescribed in the US. This is the cousin to the lisinopril drug, or that ACE inhibitor class on the other slide. So if you get that dry, annoying cough, your provider can switch you over to this drug and you will not develop cough again if it wasn't due to that other medication. Now, this medication does come with the warning of that lip, tongue, throat swelling. But in practice, we really don't see that happen. But it really depends upon the individual and what the indication for therapy is if we would try it again. Try this other medication class. So it's, again, everything is really made at a one-on-one decision with the patients. And I cannot emphasize enough, whenever you are making decisions whenever you're going to see your provider and you are making decisions about medications, please make sure you ask all the questions so you understand why you're being put on the medications, what the potential benefit is, and what the potential side effects of medication are. Your provider should be giving you the sense, as, a lot of us where I practice like to say, we're the information, we're the people to share the information, and you are the decision maker. I really want to make sure you're informed about your medication. That improves adherence altogether because you really understand what's going on. And people, obviously, you're so invested in your health if you're joined here right now because you're here to learn about different ways about your own health. So that is amazing, and kudos to you. So please always ask those questions of your provider.
Okay, I'm going to ask you a question if you don't mind.
Yeah, go for it.
Can you be on both the first ones and the second ones?
Yes, it's a great question. So can you be both on the medication class with the like lisinopril or an ACE inhibitor and an angiotensin II receptor blocker? It's not an absolute no. We tend not to do it just because there is a higher risk of side effects with potassium and kidney function. But there may be circumstances where the decision is made to do both. It's rare. I cannot say I'd seen in my practice. It's not something that I practice. But if somebody maybe is needing extra blood pressure lowering effect, or there are things with the kidneys, the good thing is we have more and more drugs are always coming out. But it is very important. You bring up a great point, though, Terry, that I want to reemphasize is anytime you're seeing a different prescriber, you want to always have your medication list with you and a written medication list, because using this class and the last class together definitely can set you up for more side effects without maybe an additional benefit. So making sure that they see that exact list, because these computer systems are still not foolproof with talking to each other. So that can be, great question.
Thank you.
We also have a question coming in from YouTube. We should say hi to Velda, LG, and Selena. A question here regarding the results of a study about beta blockers that came out on August 30th. What are your thoughts about that?
Oh, I have so many thoughts. So just for folks who may not be aware, but this is like one of my favorite times of year because we get a lot of new cardiology trials. So there has been evolving evidence for people who had previously had medical terminology. We say myocardial infarction. So you might see that in documentation. The layman's terms is heart attack. That the role, we don't have a good place in therapy for beta blockers if you've had a heart attack, and do we need a beta blocker long term? So there are certain subgroups, there are certain patients who still need to be on beta blockers, and those patients weren't included in that study. So people who have had an aortic dissection, that does not apply to them. That study does not apply to them. People who require a beta blocker to control their heart rate for a condition, an irregular heart rhythm like atrial fibrillation, or have a certain form of heart failure. Those studies, those studies do not apply to those patient groups. In patients who have had a heart attack, there may be certain features that still require people to be on beta blocker therapy. I do not stop the medication cold turkey. It is a discussion when you see your cardiologist, your primary care doctor. I think the most likely people to stop a beta blocker is going to be a cardiology provider if it might be not be something you need long term. But I do not base the, you have to have a very well educated decision making and applying those in very nuances of specific people with beta blocker therapy. And so ask those questions. Ask your provider if you're on a beta blocker therapy, do you still, is this something I still need to take? Because you want to make sure you have a clear explanation. I just listened to a great podcast on these new studies that came out. And sometimes we think of medications as like, well, they're not going to hurt you, but I don't want you to be on a medication that you don't need. And it's an extra copay you have, right? So ask those questions of your provider. And listen, if I can have less pills to swallow that I do, but if I need something, I sure as heck I'm going to swallow it, even though it might get stuck on my tongue, still going to swallow it. So ask those questions. Great question from the audience. So glad I read up on all that stuff already before I came here today. So these are in people with aortic disease, conditions of the aorta. The role of the beta blocker is to keep the heart rate on the lower end, because we know if the heart rate gets too high, people who have had a dissection and people who have an aneurysm, that can spell trouble for individuals. And so these medications have been around, I think some of them even maybe before I was born. So they have been around a very, very long time. I know I can deceive you with my excellent hairstylist work, but I am not as young as I look. So these are the most common medications that we see used, but there are definitely other beta blockers. They all end with LOL. There are side effects to know if you get started on it, especially if you're new to be getting started on medications for your aortic disease. Some people can feel sluggish in the beginning when they first start those, and your body will get used to them over time. But if fatigue persists, please talk to your provider. There's a lot of different things that can cause fatigue in life. Just recovery from, if you've had major surgery, can cause a lot of fatigue. So again, not stopping without talking to your provider about that, to really think about what could be the cause. Sexual dysfunction, primarily in males, will happen with erectile dysfunction. But discussions we will often have, even though it might it might contribute to erectile dysfunction, a lot of the conditions that people need to be on a beta blocker for also cause erectile dysfunction. And so the discussion is usually, what's the benefit of the beta blocker? And then do we treat the erectile dysfunction differently with a different agent versus changing therapy? For anybody who is on here and has diabetes, especially if you're on insulin's the most common diabetes medicine that can cause too low blood sugar. It can prevent you from noticing all the signs and symptoms of low blood sugar or hypoglycemia. So the one you'll notice is you would break out in sweats from that. But thankfully, we've made so many major advances in people who are on insulin therapy. There's much better ways to more frequently check glucose. And then if you have an underlying diagnosis of heart failure and also have aortic disease, if you're started on beta blocker therapy and you notice worsening symptoms, or the doses increase and you notice worsening heart failure symptoms, I want you to reach out to your cardiologist or whichever prescriber is adjusting that therapy quickly. These medications are miracle drugs long-term for people with heart failure, but some people, dose change could cause their symptoms to get a little worse. Okay, next slide.
I'm not sleeping. I swear.
No, it's okay.
There we go.
You tell me if one of you tell me if I speed up because I'm not looking at the time. So the next two medications we're going to talk about are two different forms that work on these calcium channels, and calcium is in our heart and our blood vessels where we're measuring blood pressure. So in people who with aortic disease, they may need a medication in addition to metoprolol to lower their heart rate, or beta blocker, or maybe they didn't tolerate a beta blocker. So medications like diltiazem and verapamil could be used for individuals. There's also certain heart arrhythmias or irregular heart rhythms that people may require one of these medications. We typically go with the beta blocker class first, but there could be reasons that this is used or used in combination. The biggest thing with this medication class is constipation. So I always say nobody likes to talk about pee, poop, or sexual dysfunction. I will talk about it all the time with patients. But so if you would get started on this, constipation is common. So you can buy things over the counter like Senna or Miralax to help. Senna these days at most stores, because I'm a geeky pharmacist, I look around at the pricing. Senna right now tends to have a lower price point to use. And then you want to make sure you have dental care, because if you are, dental care just in general is just so important for overall health. But in people with cardiac and vascular conditions such as this group, dental health is so especially important. But if you would be on one of these medications, you want to make sure you are getting dental care, because it can cause some stuff with your gums. Okay, and next slide. And then if you're not, this medication class might look very familiar for people. These are excellent blood pressure lowering medication classes. Fortunately, they don't come with having to check blood work. So these are called dihydropyridine calcium channel blockers. Their job is to lower blood pressure. And so the most common one used of this class in the United States is amlodipine. It's a once daily blood pressure lowering medication. And there are other medications in the class as well that your provider may wish to use. But in aortic disease, you're probably going to most likely see amlodipine and felodipine for blood pressure lowering. In terms of some of the formulations of nifedipine, you actually will see that come out in your stool. So please do not be alarmed. The drug was released from the product, but the tablet might come out completely intact. There's like a little hole in there and the drug zips out. That's some geeky pharmacy knowledge for you. But it can be very alarming. I still remember over 20 years ago in pharmacy school, them emphasizing, please tell patients that, because it could be very alarming if you see your medicine in the toilet. And so side effects with this medication class, you can also see it with the ones on the last slide, you'll hear, there's this medical term. Sometimes you'll hear your provider say peripheral edema, but it can be swelling in your ankles or your feet. And so this can occur with any of the drugs. The higher the dose, more common. It does not mean you're holding on to extra fluid. It is just a side effect of the drug. We don't really know why it happens, but we know it can happen. So if you're on this medication class and you notice your feet start to swell, dose change, your feet start to swell, especially if it's bothersome, please contact your provider so they can figure out, do they change the dose, stop the medication for you. And then you can also get headache and flushing with the start of therapy of these, but that should resolve on its own.
I just have a quick question about I can never say amlodipine.
Or Norvax.
Yeah.
You can say
So I've heard a lot of times that they need to load you with that medication. What does that mean?
Amiodarone.
Oh, that's right. Okay, never mind.
Is amiodarone, but that's a great question. So if you ever hear, but I can explain what that means. So you may hear with a medication that you are being loaded with it. And so what that means is that we give you a higher dose for a period of time. And we give you a higher dose for a period of time because it takes up it takes time for the drug to build up in the body.
Okay.
And so we get a lot more in up front to help it build up more quickly and then lower dose. But amiodarone is a medication. I should actually put that in here. That's a great drug to talk about. A lot of people could be on that for arrhythmias that could have happened. So yeah, you take a higher dose in the beginning and then go down to what we call, you might hear the term maintenance dose. So this is a dose you're going to take on a daily basis. Great question.
Yeah, that was the drug, because when I saw amlodipine, I'm like, I can say that one, but the other one, I had the worst time trying to say that medication.
Yeah.
Thank goodness I'm not on it anymore.
I'm glad you're not on it. It's a great drug when it works. Can be a great drug, but it has a lot of side effects. And I can tell you're pretty young, so it's not always the best long-term medicine for younger people.
Do you think I'm young? I guarantee you, I'm older than you.
Oh, it's okay. You're so young. Go ahead, Josh.
We have another one. Let's welcome Natalie to the chat, and David.
Hello.
After a TAA, aortic valve, on statin and Eliquis, occasionally get short duration mild headaches. Is this a concern?
Being on Eliquis, and what was the other med, Josh?
After a TAA and an aortic valve on a statin.
Okay. Oh, with the statin. Yep. So statins are, for those who may not be familiar with those are medications like atorvastatin, also known as Lipitor, Crestor, or rosuvastatin. They're probably the most commonly, they are the most commonly prescribed to in our country. So after people who have aortic disease, strokes, cardiovascular disease, those medications have been proven to reduce the risk of heart attack, stroke, death, and other complications. When we think of side effects of those drugs, the side effects that are going to be, that are headache is not something that comes to mind. The side effects are very rare with that medication class. They got, when they first came out 20 plus years ago, you're always evaluating drugs for safety and stuff. And those are probably one of the most well-studied classes of medications that are out there on the market, because they are used for so many different reasons. And so the side effects we think of, they're incredibly rare. You can get serious muscle pain, but it's muscle pain in the big muscle groups like your legs, your calves. But there are a lot of other conditions that can cause similar presentation. So it's really working with your prescriber to figure out if this was a potential cause of therapy. The most patients who are on it and have some kind of aches and pains, right? We have aches and pains for all kinds of different reasons. It's typically not the statin, and they are life-saving medications. So I don't think of headache with them. But if you are getting headaches, and being here, I would have, if you're getting headaches, and it's out of the norm for you, please talk to your primary care doctor, your cardiac provider. I don't think the biggest drug class that comes to mind with headaches is if you are on nitroglycerin or something called isosorbide mononitrate, dinitrate. And then we'll talk about a drug, hydralazine. They're the ones that will initially cause headaches in the beginning of therapy. And then if you do have a headache and you need to treat it, acetaminophen or Tylenol is what you want to take, because the other medications that are over the counter for pain can be very problematic in patient groups with different heart, blood vessel disease states. But
okay, we have another question that floated in here.
Yep.
Do these medications impact hormonal balance, especially for premenopausal women? Do they affect estrogen levels?
Yeah. And so the only medicine that we will talk about that can impact hormones, it can impact male and female hormones, is something called spironolactone, which is like an add-on medication for high blood pressure. But for females, it can interfere with the menstrual cycle. And for male and women, you can have breast changes, and males can have breast changes with it and sexual dysfunction with it. But in terms of interference, if premenopausal, there is the risk of menstrual irregularities, just regardless of what age you are as a female. So if you're still menstruating, it can cause menstrual irregularities. It does have a cousin, though. So if any of the hormonal side effects would happen and be bothersome, you can take its cousin. The cost of the cousin has come down dramatically. It's been on the market for over 20 years now. So a lot of places are using the cousin more and more anymore, because then you don't have to deal with this risk of these side effects coming in. But none of these other medications do we worry about hormone related side effects.
Thank you, doctor. Great answer.
You got it? Okay. All right.
Sorry. Thanks, Josh.
No, that's great. And I'm like, this is great. You guys asking questions help me. It's great for me to think about, oh, what am I going to include next? I love getting questions from folks. Clonidine is an awesome blood pressure lowering medication. This will get added on if people's blood pressure are more challenging to control. It's typically reserved for individuals under the age of 65, because if you're on it over the age of 65, some people can have more side effects that will impact the brain, making them more tired, leading to things like you'll see listed here, dry mouth, but that can happen in younger adults as well. It is a 3 times a day medication if you are taking the tablet. If you cannot do a 3 times a day medication, please just tell your provider, I am a pharmacist. I am married to a pharmacist. I can't take a 3 times a day medication. So if somebody ever prescribes you a 3 times a day med, I say to my patients, can you take it 3 times a day? And they say, no way, Jose. I'm like, great, then that is not the drug for you, right? But this is also available in a patch. If they found the right dose for you, they can then convert you to a patch once a week. So it is an option. But Terry asked the question before about medications needing to be tapered off. And clonidine is one of those, because if we cold turkey stop it, blood pressure can shoot up very quickly depending upon the dose. Okay, next slide.
And I guess the question, I'm sorry.
You hear my 8-year-old. My 8-year-old is in the next room, not happy about something. So I apologize if you hear him. Go ahead, Terry.
I was going to say, again, can you mix, or I always call it a cocktail of drugs when I'm talking to other aortic patients or people that ask me questions. I call it a cocktail. You have to find the right cocktail. Your doctors have to, coordinate together and find the right cocktail of drugs. Can these be mixed? The clonidine and the statin, not the statins are different. The prills and the other ones, what can be mixed and what can't be? Again, everybody's different and a doctor's going to tell you, but
no, that's absolutely a great question. So we know that, people within the aortic community, keeping blood pressure control is so important for everybody in this country. But with the aorta, we really know how important that is. And so up to 15-20% of Americans are going to need at least 3 medications to control their blood pressure. And so, yes, it is a combination of medications is often needed. The only medications we tend not to use together are the ACE inhibitors and the ARBs. And then we're going to talk about, and then sometimes the beta blockers and the diltiazem or verapamil. But that, again, is if you have enough heart rate, and if you need both of those, it's going because you need them both for heart rate control. So yes, it might fly up, in a pharmacy system, it might say, do you really want these together? But if somebody needs both of them to help get good heart rate control, it's needed.
Gotcha.
And then the only other thing, they wouldn't use 2 different calcium channel blockers together. There's 2 different forms of calcium channel blockers, and we wouldn't use those together. But hypertension, high blood pressure is really, like you said, a cocktail of medications. And sometimes sometimes I'll start one medicine, then because unfortunately, we don't have a magic 8-ball. So I won't know, like, some of these side effects, if it's going to happen to you or not. You might develop a side effect, and then I'm like, oh, I'm not even going to try another one in this class because of what happened. Then I have to move on to the other class. The good thing about high blood pressure medications is that we have a lot of them. Sometimes we have a lot older ones, but sometimes it is really developing. And, one person can be very sensitive to a lot of things, and it's really just trial and error to figure out what we need to do for those individuals.
Makes sense.
Mm-hmm. And so this next medication class, the thiazides, they're used to lower blood pressure. That is their job. There's 3 different medications that are on the market. The first one is one of the most challenging meds names to say. So you might see abbreviated HCTZ. The other thing I want to just point out is, when there are a lot of combination blood pressure medications. So lisinopril and HCTZ in one medication. So they're 2 different classes, but they can come in one tablet. So if cost is prohibitive for prescription refills, I mean, everything's cost prohibitive right now, but if
Yeah.
costs, that can save you on the number of pills you have to swallow. You can talk to your pharmacist about how that will impact your co-pays, because fortunately, a lot of blood pressure medications have been on the market for a very long time. So the cost is not prohibitive compared to some of our newer wonderful drugs we have out there, like Ozempic and Trulicity and Jardiance. We have these new amazing wonder drugs coming out, but they're very cost prohibitive. These, for many people, are not, because they've been around on the market so long. But there are combination products that can help out with, so you can always ask your provider about that. The most important thing with this medication class is I want you wearing sunscreen if you're on it. I don't care what color your skin tone is, you are still susceptible to the damage that can occur to the skin from this medication class. And then your provider will also monitor different blood work for you. Now, you may open the pamphlet on this drug and it will say it's a water pill or a diuretic. Sometimes people in the first couple of days of therapy will notice they're urinating more, but it is not truly a water pill. For those of you who are on a water pill like furosemide or torsemide, you know what I'm talking about with a water pill. This is not one of them. Okay, next question. Or next slide, sorry, not next question.
And the thing with the sunscreen, we should wear sunscreen. We should wear sunscreen all the time anyways.
Yeah, that is an excellent point. We really should. And, finally, I practice what I preach, and every morning I put sunscreen on my face and hands and making sure everything's covered for me. And so someone asked the question about the medications that could impact hormones. This is the first one listed here, spironolactone. If these are my favorite drugs, I'm not paid by anybody. These are my favorite medications. So these medications have a lot of great benefits for an array of different conditions. They are really helpful when there's difficult to control blood pressure. They are really wonderful for different cardiac conditions. So they are used in liver disease. There's a whole array of wonderful things that they do. Similar to what I mentioned before, these with salt substitutes, you want to stay away from salt substitutes that look like table salt, because this medication class increases potassium. And then with females, you can get breast tenderness and swelling. If you are a male, I know I've taken care of. I practice within the VA system. A large proportion of my patients are males. Looking at the trials, up to 10% of males will develop breast tenderness or breast pain with this medication, even breast growth. So please do not be embarrassed to bring it up to your provider. It is a very well known side effect of spironolactone. And if you are a female and you are still menstruating, and you're put on this medication, you're using contraceptive therapy if you are on it, because your menstrual cycle will be irregular. And then fortunately, if those side effects would occur, you can be switched to its cousin, the eplerenone drug, which I was mentioning earlier has really come down in price over the last 5 to 10 years. So a lot of prescribers are now using that E drug much more commonly, because we can avoid those other side effects. Okay, and next. Now, the next medication class I put on here, these are the water pills. So these are going to be people who have maybe certain forms of kidney disease, or they have heart failure and need a water pill because they build up with a lot of fluid. So these medications are really for symptom management, but in some individuals, such as those with certain forms of kidney disease, they will help monitor blood pressure. They will help with blood pressure lowering. Side effects is dizziness and lightheadedness for sure if too much water comes off of the body. If you have gout, it can increase your risk of gout. I also want you, if you're on this medication, checking your weight at the same time every day. Some of my patients will tell me I get up, I check it in my birthday suit, or I check it in my boxer shorts or underwear, that you are taking your weight at the same time every day on this medication class and the same level of dress. Because then if there are big shifts in weight from day to day, we want you notifying your provider. And then the last medication class I have on here is hydralazine. This is a very good blood pressure lowering medication, but is a 3 times a day medication. As I said, I could not do a 3 times a day medication. So I would be begging for an alternative. In some cases, unfortunately, this is the only option we have because of different things like kidney function. But if you would be on it, again, if they offer a medication 3 times a day and you're not sure you'll be able to do it, please let your provider know. Because if you don't do it 3 times a day, it won't control the blood pressure. But you can always talk to your pharmacist or provider for tips and tricks, such as setting a phone alarm to help you make sure you're separating your medication out through the day.
And don't snooze.
Like don't snooze.
Set your alarm, but don't snooze it.
That is a really great point, Terry. Thank you for that. So yeah, you can set phones if you have grandkids. I have teenagers. My 8-year-old can probably do more on my tech. I actually got a teenager when I was having tech trouble today. There's all these young people around you who can help you if you're like me and struggle with some of this stuff. And so that's hydralazine. I can't tell if I don't know if I have any other slides. I totally forgot. Oh, and then tobacco cessation. Smoking cessation is one of the most important things that you can do if you have aortic disease. So there's a lot of great resources out there that from the Centers of Disease Control. There is a 1-800-QUIT number. Depending what state you're in, your community pharmacist can prescribe smoking cessation products to you. Any provider that you see should talk smoking cessation products with you. What are the different options? What are the different resources? If you have tried to quit smoking before and you're afraid you're not going to quit, you know what? Sometimes we try and sometimes we relapse. Many patients, it takes several attempts to quit smoking, and that is A-okay. So something that you might have not been ready before to quit smoking, and now you're ready. But we have an arsenal of resources. People who I know use 1-800-QUIT now, they find it very helpful. They're like, I swear those people know when I'm going to pick up a cigarette and I get a text message. There's probably some text there, but it can be patient with yourself, kindness and grace with yourself, making sure you have a provider who recognizes it's an addiction. And so there are a lot of things out there. Quitting tobacco is probably the hardest thing I've ever seen patients have to do. And we have a wealth of resources. And then for tobacco cessation. And then the last thing is just some resources that are online. If you have different questions about medications that I find to be very helpful, medications, diet, tobacco cessation, that I find to be very user-friendly for individuals. So I will take any question. If there's any remaining questions, I know we are over time.
I just want to say, first of all, thank you. Thank you as always, because your information is so good. And I always hear something that, I didn't know, or that I might have to go back and ask my doctor. I can just say that, especially with the tobacco, I cannot say another word I can't say, cessation, it truly is. It has to be the right time. And this is from experience. I'm going on 15 years now of a non-smoker.
That's
and
amazing.
Thank you. It is truly, it was just the right time finally. I had tried and something clicked and I was like, that was it. And I was on Wellbutrin, actually I still am. So that was the help that I needed to do it. And luckily I did it early enough that my son doesn't even remember me smoking, which is good.
That's wonderful. And
So,
thank you for sharing your story. I
of
always
course,
really appreciate people sharing your stories because we all know that we all struggle, and knowing
absolutely,
other people's challenges is
absolutely,
really helpful.
absolutely. Just another question I have. Is it possible for somebody to not have side effects on anything?
Oh, is it question? Is it possible not to have side effects on anything? Sure, you could hit the jackpot.
That would be
And
me then.
yeah, you can be on medicines, and there's a lot we don't know about
Mhm.
genetics and our DNA. But yes, I have patients on all kinds of medicines. I get them on the highest dose where I want them to be. They feel totally fine. Nothing happens with it. Yeah, so if you don't have those side effects, that is amazing.
It is. And sometimes, especially being an advocate and talking to patients, it's difficult because I can say, I don't know. I don't know. And it's okay to say, I don't know. Go talk to your physician. Your doctor
Yes.
is the one that's going to be the person. And you also had mentioned genetics and DNA. That is tomorrow night. We're going to talk about that stuff on our live show with our
Oh, very interesting.
geneticist. So,
That's awesome. Yeah, so much more coming out in that area. I'm glad you guys have
mhm,
access to it, because I'm sure those of you especially people with children and stuff, that can be
yes,
a very big
yes,
worry. Very
yeah.
big worry.
Josh, do we have any more questions before we're really, really running late?
The chat is quiet.
Okay.
Doctor, thank
Well,
you
hi
so
everybody
much.
that was out there.
Thank you so much for having me again. And
Thank you.
feedback, suggestions, and things to talk about, please let me know. So when I do come back, I'll just beg to come back if she doesn't
Uh,
call me. Let me
no,
know.
we'll have you back. Don't worry, we'll have you back. If Karen says no, I'll say yes. So, well, thank you, everybody. I thank you for joining us tonight, everybody. Thank you, Dr. Watson. It was amazing as always. And thank you. Yeah, excuse me. Thank you for your patience during our technical difficulties. And we will definitely see you soon. Make sure to tune into AHTV. You want to like and subscribe. And we'll have another live event tomorrow. Just another quick thing, real quick. This month of September is Aortic Disease Awareness Month. So there is a lot going on. Make sure you check out our Facebook page. Make sure you check out YouTube, our AHTV channel, and our website as well, because we have a lot going on this month. So thank you, everyone. Have a great evening, and we'll talk to you soon.